Hi there, welcome to this in-depth video on COPD. This is the second video of a two-part video series I made on COPD. In the first video we covered an overview on COPD, the pathophysiology and the risk factors, and in this video we cover symptoms of COPD, how to diagnose it, how to treat it, and how to rank the severity of your COPD with the GOLD classification. If you're interested in that first video, see the link in the description, and otherwise keep on watching. I also made a shorter, more to the point video on COPD that might be more suitable for patients. If you're interested in that one, see the link in the description as well. If you're meeting for the first time, my name is Raoul. I'm a final year medical student from the Netherlands. Feel free to subscribe for more upcoming videos. Now let's get started. And as always, I always start with a little disclaimer. All my videos are purely informational, they are not medical advice. And if you're looking for medical advice, always contact your own doctor. So this brings us to the slides of the second part of this presentation. Symptoms. Symptoms of COPD start to get noticed when they're there longer than 3 months, and they will get worse and worse. They are progressive. COPD has 3 main symptoms, so shortness of breath, dyspnea, productive cough, and an increased mucus production of clear mucus. It can also cause chest tightness and wheezing, which is a squeaky breathing. In COPD, the symptoms get worse and worse, and eventually it will be hard for you to do your daily routine. This may lead to difficulties in dressing yourself, cooking, or even walking. The first symptom usually is coughing. This is caused by the increased sputum production, and it can be so severe it causes rib fractures or loss of consciousness. The worst symptom, however, is dyspnea, so shortness of breath. First you will only have it during exercise, but later you will even have it in rest. This contributes to anxiety and a poor quality of life. Therefore, people with dyspnea breathe through pursed lips, like this. This makes it easier to in and exhale. Patients with COPD can also suffer from COPD exacerbation. Those are episodes of increased symptoms, so they have more shortness of breath, more coughing, more sputum production. Sputum also changes from color, from clear it goes to a yellowish green, and they need to work a lot harder for their breathing. The heart rate goes up, their breathing tempo goes up, they have a tripod position, which is that their hands are behind their back. This increases the volume in your lungs. You will see a raised jugular venous pressure in those patients. They will sweat more from the exercise. They also will use active muscles in their neck as accessory muscles. They will get a bluish tint. This is the sinus of the low oxygen saturation. And there might be confusion or even hyperventilation. COPD exacerbation is caused by triggers. Most oftenly, this is an infection, bacterial or viral, in 50 to 75% of all cases. Another trigger can be environmental pollution, so poor in or outdoor air quality, smoke, or even a cold temperature during the winter, for example. And lastly, improper use of COPD medication may also lead to COPD exacerbations. And this brings us to the diagnostics. You should consider diagnostics in patients older than 35 to 40 years with a chronic cough for more than 3 months, difficulties breathing, and a history of smoking. You always start with an examination. You do your anamnesis, you ask them the questions, you listen to their lungs if you have a squeaky breathing or maybe a prolonged exhale. At the end, if you still suspect that they have COPD, you will do a lung function test, a spirometry. Also do a chest x-ray and a complete blood count to rule out other possibilities. Spirometry is the best diagnostic test to diagnose if somebody has COPD or maybe even asthma. You do this before medication, then you take a bronchodilator, and then you do it again. This lung function then measures your flow, your volume, and your airflow reduction. And typically in COPD patients there will be no improvement after the use of medication. This test gives several useful values, but most importantly we're looking at the FEV1, which is the forced expiratory volume in 1 second. We'll look to the forced vital capacity, so this is all the air you can breathe in and out. And then lastly, you compare those two. In normal patients, this is 75 to 80, but when it's less than 70, you most likely will have COPD. This brings us to the severity. COPD can be classified in the GOLD classifications. There are 4 categories, A, B, C, D. In grade A, a patient has few symptoms and a low risk on an exacerbation. In grade B, they have more symptoms, but still a low risk of an exacerbation. In grade C, a patient has low symptoms, but there's a high risk for exacerbations. And in grade D, which is the worst one, A patient has a lot of symptoms and also a high risk on exacerbations of COPD. If we're looking at this figure, we see that at the left side, the GOLD classification airflow limitation is set. It goes from 1 to 4, 4 being the highest. On the right side of this figure, we see risk of exacerbation history. So if you had 0 to 1 exacerbation last year, you still have a low risk. But if you had more than 2, you have a high risk. That brings you to category C or D. At the bottom, you see questionnaires for symptoms. The first being MMRC. And if you score a 0 to 1, you have low symptoms. But if you have more than 2, you have a lot of symptoms. Or you have CAT. And if you have a score less than 10, you have low symptoms. But more than 10 gives you a lot of symptoms. So this is how to evaluate the GOLD classification. And this brings us to prevention. Prevention actually is really simple. Reduce your risk factors. And most importantly, stop smoking. Because smoking is the major component that contributes to COPD. And even if you have COPD, it's important to stop smoking because it will limit the progress of your COPD and improve your symptoms. So that's important. Secondly, also improve the in and outdoor air quality in your house or in your environment. However, if you cannot prevent COPD and you already have it, then that brings us to treatment. Unfortunately, there's no cure, but there are some steps you can take. The first step, and maybe the most important one, are lifestyle interventions. So stop smoking, stop smoking, stop smoking. I cannot stress this enough. This is the most important step. Furthermore, take the appropriate vaccinations. Most importantly, the influenza vaccination. You should take it every year because it decreases the amount of pulmonary infections you will have and therefore will less likely trigger a COPD exacerbation. Also do enough exercise and try to walk every day 30 minutes to an hour. Start slowly and build it up. And lastly, do weight reductions if you're overweight. However, if this is insufficient and you still have complaints, you go to step 2. This is a short-acting bronchodilatator, and this medication helps to open up your lungs and makes it easier to breathe when you have complaints. However, if the short-acting bronchodilatator does not work enough and you still have a lot of complaints, you go to step 3. And this is a long-acting bronchodilatator, and you can add pulmonary rehabilitation if necessary. If this is insufficient, you go to step 4, which is inhaled glucocorticosteroids. Those inhibit the inflammation process in your lungs and also improve your symptoms. And your last step would be long-term oxygen if you have insufficient oxygen, or even a lung transplantation if necessary. Also, at any point, if there is acute worsening of the symptoms, maybe the medication needs to be increased or a hospitalization is necessary. And this brings us to the end of my videos on COPD. I hope you learned a lot. Feel free to ask questions in the comment section and subscribe for more upcoming videos. See you next time. Bye bye.